Folks, if you read any right-wing media in the United States for the past decade, half decade, 2 decades, I don't know how far going back, they have this lovely talking point that they love to raise. Quote, healthcare is not a right. Right? And they say this. And like, I remember that the Ayn Rand, the Ayn Rand Society or the Ayn Rand Institute was having a whole seminars around the theme, healthcare is not a right. I debated a libertarian a couple weeks back or a week ago, and they all said healthcare is not a right. And that this is like one of the central views of the libertarian, conservative, free market crowd. They really strongly believe that healthcare is not a right, that it is just, you are not, and they love, it's like a philosophical conversation that they love to have. They say, well, look, when you get healthcare, that is an imposition on someone else, right? You have negative liberty, right? You have the right to freely say whatever you want. You have the right to practice whatever religion you want, but you do not have the right to impose on others. By giving you healthcare as a right, you are imposing on someone else, right? You're imposing on that doctor. You're imposing on society to pay for it. Therefore, healthcare is not a right. This is. I mean, you've heard it, right? I mean, if you listen to PragerU, you listen to anything, Libertarian, Cato Institute, they pound this home like it is a central plank in their beliefs. Healthcare is not a right. Your health is your business. It is not my job to keep you from getting sick. It is not my job to give you healthcare when you are sick. You're on your own, folks. If you have a health problem, that's between you and the doctor. It's not my problem. It's on you, and society cannot be obligated to help you, right? That healthcare is an individual issue, right? And that you as an individual are responsible for your health. And the doctor, it's up to you to persuade that doctor and persuade that insurance company, and you are on your own with healthcare because that's the natural law and that's the way things have to be, and that's John Locke and life, liberty, and the pursuit of happiness and individual rights and the non-aggression principle and blah 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 blah. Blah, 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 freedom, liberty, blah, 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 constitution, blah, 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 communism, blah, 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 Nazis, death camps, blah, 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 healthcare is not a right. We've all heard this. I mean, we've heard this ad nauseum, right? Healthcare, they say, is an individual question. Folks, the coronavirus. Healthcare is very clearly not an individual question. Look at this. This is an issue that we are having to tackle not as individuals, not as neighborhoods, not even as countries. This is something that the entire global community has to deal with as a group. There is no way that the situation surrounding the coronavirus can be dealt with on an individual level. This is a society-wide problem. It's a planet-wide problem. There is no way that you can address an issue like coronavirus with this belief that healthcare is an individual issue. Right? According to these libertarians, our response to coronavirus ought to be, well, that's between you and your doctor. Good luck with it. But nobody is stupid enough to say that. Right? No one's sitting there going, well, these people that got coronavirus, that's not my problem. What? Why? Because they walk around. You might get infected. Your neighbor might get infected. We as a society, as a city, as a country, as a global community, have to deal with this health issue, because when it gets down to it, healthcare is an issue that affects everyone. Healthcare is an issue that affects everyone. If people are walking around diseased, that's bad for everyone else. If you're in a society where people don't have proper medical care, even if you yourself can afford that proper medical care, you are affected negatively by it. The reality is, issues like healthcare cannot be viewed as individual issues. Healthcare, in fact, can be declared to be a right. It can be declared to be a right, right? When you have health problems, it becomes society's problem. And you can't get around this, right? According to the libertarians, according to the libertarian free market, Cato Institute, Ayn Rand school of thought, this coronavirus should be, hey, we should just be saying, hey, well, that's between you and your doctor. It's between people with coronavirus and their doctor, right? We shouldn't be having travel warnings. We shouldn't be distributing masks. We shouldn't be doing everything we can to get ready for it, right? It's just healthcare is an individual question, isn't it? It's just between you and your doctor, and then the state should not impose, the government, blah, blah. It's malarkey. The coronavirus is the strongest argument I've ever seen that the government has an obligation to protect the health of the public. And if the government were to get up now and announce that healthcare is not a right and that coronavirus, well, it's your problem, you're on your own, that's between you and your doctor, the government's best, the government's least. If the government were to get up and do that, there would be riots in the streets. There would be a revolt. There would be an upsurge. There would be chaos. People would rise up. People expect the government and society at large to handle the coronavirus. People expect the government to step in and ensure public health. Right? It's that simple, folks, right? If the government does not provide clean drinking water, you are probably going to at some point drink water that's contaminated. You might say, well, I would, the private market, blah, blah, blah. Yeah, but if there's a bunch of people with contaminated water around you, even if you can afford clean health care, you're going to have to deal with the fact that you live in a society in which people all around you are drinking contaminated water. If you, for example, are in a society where all kinds of people are dying of preventable diseases, and you yourself have the money to deal with it, you're still having to suffer from the reality of living in a society where there's all kinds of people walking around with all kinds of diseases that are preventable, right? There's a reason that we mandate vaccinations. There's a reason that we have public health codes. Why? Because healthcare is a collective issue. And on that basis, it can be declared a right. Human beings are collective creatures. We always have been collective creatures. If you go back to hunter-gatherer civilizations, we were tribal, right? You go back to the ancient empires, the pyramids that were built, the Colosseum in Rome, all of that was human beings working together, right? That human beings work in groups. They are not individuals. And this non-aggression principle that no one should ever impose on anybody else, this idea that everyone's on their own and the government should just step out and the market always creates the best solution, this is malarkey. It's malarkey.